Hi class, Dr. Hastings here, just providing a brief introduction for the Week 1 content role of nurse educators. I'm just going to flip through this slide panel for a moment and give you some overview to the content. We first look at the complexity of the healthcare landscape and how that certainly puts the bar high for nurse educators to be able to be effective in their roles at teaching nursing students, let alone novice or experienced nurses, to be competent relative to how complex healthcare has become. We look at the expectations then of being high and for designing effective curricula, and be that for a class in the academic setting, let alone a teaching module, and correlate that to the institutional setting. How critically important it is to design annual or competency-based education modules for staff and for patient education to help the staff become good patient educators. So stay holistically grounded in all this. Consider the enormity of how we impact nurse providers and hence then the public in our roles. So from the higher ed perspective, understand how virtuous and honorable our profession is, and also understand and consider the challenges between the academic setting as well as the clinical setting and the institutional environment. For the professional development specialist, having the KSAs to be able to effectively be grounded in the role of providing good training and being able to support learning that is meaningful within the ranks of nurse professionals who are novices or experienced, let alone nursing students. And I did provide a brief brief article with a link on Medscape that gives a quick summary description. I'll be providing other information as the course unfolds that I'm gathering from Lehigh Valley Hospital Network and St. Luke's that also support nurse professional development specialists or the education departments regionally in a more substantive way. So in the nurse educator role perspectives for nurse training and becoming an RN, always consider the history. It's still remarkable how we grew from an in-house apprenticeship type of model to where we are today with a professional discipline that has our own knowledge base and ability to generate knowledge and evolve. It's important to consider how in the academic side the expectations are high. It's not just one role. You're not just a teacher at a college. You do have expectations then to be involved in helping guide the processes within the college, i.e. committee work, let alone be involved in scholarship and service and mentoring. So a lot of things to juggle. The academic side, for sure, institutions make this complicated. This whole notion of tenure goes to the lifetime commitment kind of scenario. Quite a climb, and I'm myself pondering the enormity of it in consideration of where my career is moving towards. But in all this, understand that notion of instruction is not always grounded in tenure. And for those of us who are acting more on a contractual basis and as instructors, we don't tend to think in those terms. But we do tend to think broadly about our socialization within the academic setting and how we can be effective. So we can talk more in discussion over those kind of considerations in a balance of the academic responsibilities and expectations to be in a higher education environment at one point. In all this, we should be grounded on either side in the fact that we are practitioner-based, that clinical instruction is critical to what we do. And our first concern is teaching. In the academic side, nursing students. In the institutional side, it is going to be for novice or experienced nurses at clinical agencies. And one of the drivers that's become quite viable over the last 10 years is a model coming out of the Robert Wood Johnson Foundation, referring to CUSIN, or the CUSIN Competency Quality and safety education for nursing. So I provide the link. Take a look. It's an interesting read. Think about KSAs that are part of who we are and what we need to do within the clinical setting. We need to be proficient in all the processes and practices of education to support good learning and then good outcomes relative to our students and our novice or experienced nurses when they get annuals and research and training. Think Boyer, that puts the bar high. It's a progression and certainly goes from more simple to complex in terms of our understanding about how to build educational processes. Consider the big drivers out there, National League for Nursing, AACN. These folks are writing the book on competencies for nurse educators, as well as CUSIN. And consider, again, scholarly work that supports nurse educators, even the nurse professional development specialists. Our library does not have or support the Journal for Nurses and Professional Development out of AMPD, but it does support all the other nursing journals on this page. So take a look. I mean, these are things that we're going to access during the course. Considering credentialing in ANCC or NLN, how that grounds you in advanced practice or in a specialty genre, and the NLN certification for nurse educators, something I will seek fairly soon, is also very important. So we'll talk more about teaching in a clinical environment later in the course, but I mention this as an endpoint, sort of just to say, again, the Billings and Halstead book tends more to refer to academia versus the institutionally based educators, but we will make sure that that is a consideration, content delivery, and in discussion in terms of balancing this content as we move forward in the course and as the course unfolds. All right, thank you for your attention to this introduction, and I hope we have a great first week in Nursing 531.